Diabetes is a disease which can lead to long-term complications. They will be described in detail in the next few minutes. All the complications of diabetes are more likely to occur when the diabetes is poorly controlled. If you can control your diabetes with diet, exercise, medications and insulin, so that your blood sugar levels are always less than 9 millimoles per litre, your risk of complications of diabetes is significantly reduced. Each year, you should have an annual review appointment to discuss your diabetes with your diabetes specialist. They will carry out a series of tests as described next. HbA1c. This is a measure of how well your diabetes is controlled. It gives a measure of your blood glucose control over the past 3 months. Everyone will have a different level, but we aim for a level between 6 and 7.5%, depending on your treatment regime. Your diabetes specialist will give you a target level for your HbA1c, urea and electrolytes. This is a group of tests which measure your kidney function. Diabetes is the biggest cause of kidney failure in the UK. It is important that your doctor reviews these tests annually. If the levels are not normal, your doctor will discuss with you what the results show. Liver function tests. These tests look at your liver function. These tests are important if you take cholesterol tablets, and they also contain various other markers. If there are any problems with these tests, your doctor will discuss these at your annual review. Lipids or cholesterol. These tests usually combine 4 tests in one. The results will give a total cholesterol to LDL cholesterol ratio, which should be less than 4. In people with diabetes, the target levels for cholesterol are tighter than those for the general population, as the risk of heart disease is higher in people with diabetes. If your cholesterol levels are too high, you will be given dietary advice to reduce it and be prescribed tablets known as statins. Thyroid function tests. These tests are a screening test, as thyroid diseases are more commonly found in people with diabetes. If these tests are abnormal, you may need medication to correct the imbalance in your thyroid function. Diabetes is a major cause of kidney disease called diabetic nephropathy. Your kidneys are important for filtering waste products from the body and eliminating these products through urine production. In severe kidney disease, the kidneys may stop working, so a dialysis machine is used as a replacement. As with all the complications of diabetes, the risk of diabetic nephropathy increases with poor diabetes control. High blood pressure will also increase your risk of kidney disease. Your blood pressure should be lower than 135/80. To reduce your risk of diabetic nephropathy, you can do the following. Reduce the salt intake in your diet. Stop smoking. Have your blood pressure checked regularly and take any medications prescribed on a regular basis. Take your diabetes medication regularly. Take regular exercise. Your doctor or nurse will also do some tests at your annual review to check your kidney function. This will include taking an early morning specimen of urine to test for protein and microalbumin. Perform routine blood tests to check your kidney function and your diabetes control. When you attend your GP surgery or the hospital clinic for your annual review, your diabetes specialist will examine your feet and look for potential problems caused by diabetes. They will check for pulses in your foot to look for good blood circulation, sensation or feeling in your foot using a monofilament. They may also check for vibration using a tuning fork. You can look after your feet to help prevent problems. You should wash your feet daily with mild soap and water, cut toenails straight across, not too short, file your nails to get rid of sharp edges, Look between your toes for any problems. If you get moist skin between the toes, you can apply surgical spirit. If you have dry skin or hard areas of skin, apply moisturizer daily on the top and bottom of your feet, but not in between the toes. Wear clean socks at least daily, and choose ones which do not have restrictive, elasticated areas. Always wear shoes inside the house and outdoors. You should wear shoes with fastenings, such as laces, buckles, or Velcro. Slip-on shoes are not recommended as they can damage your feet. Always check your shoes don't contain stones before putting them on. Diabetes is the biggest cause of blindness in people under 65 years of age in the UK. This is due to changes in the retina at the back of the eye, called retinopathy. Diabetic retinopathy is more likely to develop in people who have poorly controlled diabetes. Most loss of vision due to diabetes can be prevented, but it is vital that any changes are diagnosed early. These can only be detected by a detailed examination of the eyes. Your GP should refer you to a special centre for retinal screening. This will involve reading an eye chart through pinholes to test visual acuity, having drops put in the eyes to dilate the pupils, have photographs taken of the retina at the back of the eye. You may also have an eye examination by a specialist in eyes. This examination should take place every year. With regular screening, any problems with the retina can be treated early and prevented from deteriorating further. It is important not to drive to the appointment, as the eye drops may affect your vision for up to 4 hours. Cardiovascular diseases are the most common complications in people with diabetes. Damage to the heart and blood vessels is caused by poorly controlled diabetes and the build-up of cholesterol on the linings of the blood vessels. The build-up of cholesterol reduces the width of the blood vessels, which can result in a heart attack or stroke. Cardiovascular disease is a major cause of ill health, but people with diabetes have 4 times the risk of coronary heart disease, stroke, and circulation problems. You can reduce your risk of cardiovascular disease by stopping smoking, doing regular exercise at least 30 minutes 5 days per week, lose weight if overweight, decreasing the amounts of fat in your diet, reduce the amount of salt in your diet, having your blood pressure and cholesterol checked regularly, take your diabetes, blood pressure, and other prescribed medications regularly, having good diabetes control. You may be prescribed medications which reduce your risk of cardiovascular complications, such as low-dose aspirin and medications to reduce your cholesterol. Cigarette smoking is a major cause of many illnesses, including cancers, heart disease, chest problems, poor circulation, and loss of sense of taste and smell. When you have diabetes, you have an increased risk of cardiovascular disease. If you smoke, this risk is even higher. If you can give up smoking, your risk of cardiovascular disease will decrease, reducing your risk of heart attack, stroke, amputation, and painful vascular disease. Stopping smoking is not easy, but the benefits will outweigh any temporary withdrawal effects. If you stop smoking with a friend, this can make it easier. Support is available from your practice nurse or GP, the local hospital, the NHS Smoking Helpline on 0800 169 0169, your local pharmacist. There are many types of support available to help you stop smoking, including individual support sessions, nicotine replacement, such as patches, gums, inhalators, nasal sprays, microtabs, lozenges, supervised medications. One of the most important parts of giving up smoking is setting a date to stop. Talk to your health professional soon to set a date and plan the support you prefer.